Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. On this channel we talk a lot about the mental health nursing OSCE. So if this is your first time, please make sure you click on the subscription button and turn on the notification bell. And anytime I upload a video, you'll be notified and you'll come straight here and take a look at whatever video that I have uploaded. I have a lot of videos on the mental health OSCE, starting from the API through to the skill station to evidence-based and professional values as well. If you are new here, there is a WhatsApp channel that I have created. You can find a link in the description where you can join the WhatsApp group on daily basis or on weekly basis. I do put in scenarios and ask questions, and there's feedbacks where you can learn from as well. And if you also want to have access to my booklets, whether the API booklet, the skill booklet, you can also find the link in the description, and then you can have access to that as well. So today's video is going to be very simple. Today we'll be looking at the assessment station, and specifically we'll be looking at the manic phase. So usually you have people, they've gone in, they've done the assessment. Now the outcome usually determines the problems that they are going to get, and then or the problems that they've been able to identify, and based on these problems they are going to use that in the planning phase to draw a care plan for the patient. But usually people are always struggling with the outcomes of the assessment that they do. So I have basically put together some likely outcomes that you can get from your manic phase assessment, and these outcomes are usually more or less like the risk that you have identified, and then you discuss that with the patient, and out of these risks you usually get the problems out of that, and then you can prioritize them and you use them to draw your care plan in the planning station. So these are like a collation of outcomes in terms of risk that you should be able to identify, or you are likely to identify if you are assessing a patient who is manic. We are going to go through them, and then one by one I'm going to explain them, and out of this you realize that there are some very key problems that you'll be able to identify here, and then you can easily use that to draw your care plan. So we are first of all going to start from the risks for injury, and then of course you know that this is usually due to hyperactivity, impulsivity, and then reduced judgment. Usually when you have patients that are hyperactive or that they are manic, you can find them moving around restless, and then most of the times or sometimes this can lead to injuries. They can bang their heads, they can step on shafts, and usually these patients, they don't care. They are just so much fixated on whatever they are doing to the neglect of the injuries that they get. And injuries are something that as professionals we have to take into consideration as a risk whenever we are assessing such patient, because once the injuries keeps on increasing, there's some physical health issues that can also set in, like infections and all of that. And as a mental health nurse, if you're assessing a patient who keeps on getting injury, then this is a risk area that you would have to look at. Then we also have risks for violence. This can either be self-directed or directed at others, and usually this results from like irritability, agitation, or aggression. So if you have a patient that is manic, in their manic phase, sometimes they can be really irritable, and this can lead to aggression, either towards other people or even self-violence to themselves. And then some of them, if you have seen a typical manic patient, some of them might be banging their head on a wall or something. They don't really care about whatever injuries that they will get. Then we can also have sleep disturbance, which is normally due to the need for sleep and heightened energy levels. So usually manic patients, they are really heightened in terms of they're moving around. In terms of their mood, is more or less like to the peak, so they are just all over the place, and usually they wouldn't even have time to sleep, and this can cause disturbances in their sleep. Then we can also have impaired social interaction as a result of intrusive or inappropriate or aggressive behavior. So when it happens this way, usually you can have they are not able to really interact very well. If they are at home, people might try to avoid them, or they themselves might try to avoid people, and this can lead to in terms of their interaction with people, this can really lead to impairment. Then we can have imbalanced nutrition as well, which is also a key thing here, because there's a risk for insufficient intake due to distraction and then hyperactivity. Even if you offer them food, they might not eat. They are so much disturbed, or they are distracted to the point that they might not even consider eating, and this can lead to risks for malnutrition or imbalanced nutrition. Then we can have impaired thought process. This usually, when you have patients that are in their manic phase, usually you can have their thought process being impaired, and this usually is evidenced by exhibition of some grandiosity, racing thought, and then of course inability to concentrate as well. When you have somebody who is having ruminating thought, they are usually their thought process is like it's on a speed, or it is always at a run, and then they are not able to think straight. Then we can also have deficient self-care. This of course will be due to neglect of personal and then basic needs. So when you have a patient that is manic, usually they can neglect taking care of their personal hygiene, and then basic needs like laundry and things like that, that can keep themselves neat. Then we can also have ineffective coping, resulting from inability to manage stress or recognize the severity of the situation. So usually if you have somebody in manic state and you're trying to explain to them that you cannot do that, you cannot do that, they don't really see that as a problem, or they don't recognize the severity of that, and that can cause ineffective coping. Then we can also have disturbed sensory perception, especially in cases where there is delusions, where there is hallucinations. Usually can have their sensories or their perception being disturbed here. Then of course the last one is going to be non-adherence to medication, which is due to either lack of insight into their condition or even refusal to take their medication. So these are some of the likely outcomes that you are likely to get if you are assessing a manic patient, and you can see that out of these, some of them are at risk, some of them are like directly problems that you can use, something like the nutrition, something like the risk for injury, the sleep impairment or the sleep disturbances, risk for violence. These are outcomes that you can base your interventions on. So if, for example, you have a patient who is risk for violence to others or to his immediate family, these are genuine reasons where you can suggest an admission to such a patient, and then you have to explain the reason why you are suggesting such an intervention to them. So yeah, those of you that have been asking about the some of the likely outcomes for the manic phase, there you go. These are some of them, and out of these, as I said, some of them are risk, some of them are problems. In my next video, we'll take a look at the depression and suicidal ideation as well. We'll look at some of the likely outcomes, and then whether we can categorize them under risk, or you can categorize them under problems which you can use to write your care plan. My name is Enos, and as I said, if you need my booklets, they would be in the description. If you want to join the WhatsApp group, the link will also be in the description. Please make sure you subscribe to the channel and turn on the notification bell, and anytime I upload a video, you would be notified and you'll come straight here and take a look at the video. My name is Enos, and until I see you in my next video,